to my channel. My name is Sam and I am a content creator on Instagram, TikTok, and now YouTube. My content mainly focuses on spreading awareness for chronic illness and speaking about my own experience with chronic illness, specifically stage 4 endometriosis, adenomyosis, interstitial cystitis, and HS. Today, as you can tell by the title, we are going to be talking about my diagnosis journey in great detail, as well as my experience with surgery and what I have been doing post-op for treatment and basically just managing my own chronic illnesses. So I do have to make a lot of disclaimers, and the first and most important piece of information that I like to disclaim is that I am not a doctor, I don't claim to be, and I have no medical experience whatsoever. So everything I say here today is just based off of my own experiences, what other endo warriors I know have been through, what specialists have told me previously, what research I've done on my own, but none of it is medical advice, and everything I say should always be taken with a grain of salt, because what works for me might not work for you. What I've been through might not be the same situation that you're in. Everybody looks different when it comes to chronic illness. So now that we've got the boring disclaimers out of the way, we can go ahead and get started with my diagnosis journey. Hi friends, I am in the middle of editing this video right now, so excuse this. But I have noticed that several of my clips are missing. So I really hate that, but I am going to have to insert myself looking like this to kind of fill in the gaps where things are missing. And I can just tell, like, watching this back, I was having a terrible brain fog day. There are several points in this video where I look genuinely blank in the face and I'm not saying things that make sense. So I do really apologize. Obviously this is like my first YouTube video, so I will get better, and I'm sure I'll learn a lot of things along the way, but yeah, just a fair warning. So when I was around 12 or 13 years old, I began menstruating. I had my first period, and that is when my symptoms started to occur. Specifically, I noticed that my periods were extremely painful and heavy. Heavy meaning I was bleeding through a night pad within an hour, and those are supposed to last between 6 to 8 hours, I believe. So it was very, very uncomfortable. I couldn't even really go out because I would constantly have to change my pad, and at that time I wasn't wearing tampons because it was my first period. But even then, as I got older and I was wearing tampons, I would bleed through a super tampon and a night pad within an hour. So it was pretty heavy. And by painful, I mean I was bent over in pain, I was curled up in a ball, I was puking, I was fainting, I couldn't go to school. I had to write doctor's notes to get out of PE, sports, any kind of extracurricular activities that I had at the time. Pretty quickly after I started my periods, my mom kind of noticed that this was becoming a trend, and she was kind of concerned because she didn't have periods like that. So she decided to take me to a general doctor, like a family doctor, and I got the same answer that pretty much everybody gets when they go to a doctor to complain about period pain and, you know, heaviness. And that was that it was normal. It was a part of being a woman, that everybody has it, and the only way to fix it is to go on birth control. It will regulate your periods, it will get rid of acne, it will make you basically feel better. They wrote it off as this like magical pill. And at that time, of course, I believed them because I didn't know any better, and I didn't know about endometriosis. It wasn't taught in school. And quite frankly, I didn't know what it was until I was diagnosed, because no doctors ever brought it up to me along the way as a possibility. So I took the birth control, and at first it really did help. It made my periods a lot lighter, a lot more manageable. And I did notice that in general, I was able to kind of get out of the house and do normal activities on my period. So I was really happy, and I honestly thought that I was going to be good. As the years went by, I started to notice other symptoms outside of my period that kind of started to creep into my life. Specifically, I noticed lower back pain that was pretty chronic, and the pain would shoot down into my legs. It was worse on my right side, and it was worse when I was laying down. I also started to notice some abdominal bloating, cramping, pain, digestion issues like constipation, and some food sensitivity issues, specifically to gluten and dairy. As I became sexually active, I also noticed that I was having pain with sex. Initially, it was just kind of like in the beginning, and then it would kind of go away, but eventually it was pain with penetration just in general, whether it be fingers, other things that are a little bit bigger. I even noticed that tampons began to hurt as well. But with sex specifically, I had pain with penetration, and also afterwards I would have really deep cramps. I also began to notice that I was having pain with urination and bowel movements. Specifically, when it came to urination, I was having kind of like a frequency issue. I always felt like I had a chronic UTI. It stung, it burned, and I also experienced pain with bowel movements, so just kind of like cramping and sharp pains when I was trying to go number 2. So all of these symptoms started to kind of creep up on me. They weren't like boom, really bad to begin with and like really debilitating, but they kind of just slowly got worse and worse over time. And around the time they started to kind of get a little bit bad and like kind of debilitating, I was actually having a really big life change. I was moving from my hometown in Newbury Park, California, to here in Orange County, California. And at that time, because I was in high school, I had to see a general doctor here and get like a checkup because the school required it. So I went to that doctor and basically told her, I'm having these kind of weird symptoms and I'm on this type of birth control. I was telling her kind of my medical history and all this stuff, and the only thing that she really focused on at that time was my birth control. And she basically told me like, oh, you know what, your doctor put you on a really high estrogen birth control, and I don't think that's really healthy, so I'm going to put you on a lower dose estrogen birth control pill. I'm back. This is a part where I accidentally lost a clip, but at this point I ended up taking my doctor's advice and I went on the low dose of estrogen birth control pill. And as soon as I started it, I noticed side effects that I wasn't a fan of, like acne, weight gain, mood swings. I kind of felt like I had the flu all the time, if that makes sense. And I also noticed that it wasn't helping as much with my periods. So my periods started to kind of get heavy again, and the cramps became really painful again, and it was becoming kind of unmanageable. And I didn't experience this on the high dose of estrogen birth control pill. But as I mentioned, kind of slowly, everything started to kind of creep up on me. And then once I switched the birth control, that's when everything kind of just went downhill for me. So at this point, I was feeling like shit on my birth control pill, and then all of my other symptoms that I didn't know where they were coming from at that time, of course, they were kind of creeping up and making everything worse. So I decided to kind of take control and decided to go on like a health kick and rid my life of toxic chemicals and processed foods and eat all organic and vegan, gluten-free, dairy-free, like all this different lifestyle changes. And with that, I decided to look into other forms of birth control that weren't hormone-based, because at that time I was also just looking into birth control, and I was reading a lot about how birth control can be really toxic. It's synthetic hormones, which don't sit well with a lot of people, and some people just generally do better off of hormones. So I was looking into it, just hoping that I could find like a non-hormonal birth control that will help not only with periods and stuff like that, but also just for contraception at that point. And then I came across the copper IUD. This was definitely the biggest mistake I could have made. But I also don't blame myself fully, because I should have had a doctor that took into consideration my medical history and steered me away from it. But honestly, no hard feelings, because it did actually end up leading to my diagnosis. So it worked out in the end, even though it was hell along the way. So I went to a gynecologist. This was my first time ever being at one. And I told her, my history, what symptoms I was experiencing, and what my periods are like, sex is like, all that stuff. Of course, they don't focus on that. And she basically just focused on me wanting to get that copper IUD. She was talking about all the positive things, all of the really good outcomes that could possibly happen, but with no mention of any of the negative things that could possibly happen, side effects, complications, none of that. So I decided to get it placed. Placement for it, horrible. I would love to do a story time on that whole experience, because not only did it take multiple appointments to get it in, but it was just a horrifying, terrible experience. And there's a lot that I genuinely think should be done for patients with IUD placements. I mean, men who get vasectomies get prescribed pain control medication. People that get IUDs don't get offered that. I'm pretty sure you can ask, but I don't know if a lot of doctors are willing to do that or what really the protocol is. But as far as I know, at least in the US, it's not standard to give pain control medication for IUD insertion. They kind of just tell you to take ibuprofen before and you're good to go. But I definitely took ibuprofen before and I was wincing in pain. Anyways, that's for a different day. Immediately after insertion, it was really painful for, the first couple weeks. I was having really deep cramps. I was bleeding uncontrollably, really heavily, but my gynecologist swore that that was all normal, that, everybody kind of adjusts to it differently, but on average it takes about 6 months to adjust to an IUD, so you may have cramping, spotting, heavy bleeding, all that stuff to begin with. So I tried to give it a chance, and for months and months I was having pain with it, I was having cramping, and eventually the pain got so bad, specifically in my right ovary, that I was concerned. So again, I decided to look up some things, possible complications I can have from an IUD, because like I said, that right ovary pain was killing me. And I was really scared and concerned. So when I was looking up things, of course, the one thing that came across my search is that IUDs can possibly move out of place. So I was like, great, that's exactly what it is. My IUD is just out of place. It's trying to expel itself. So I just need to get an ultrasound and see if it's still in place. And if not, they can remove it and replace it. So asking for this ultrasound was hard enough. My gynecologist was not willing to do it. I had to basically beg. I was saying, I'm in so much pain, I can't even function. Please, I just want this ultrasound. Reluctantly, she gave it to me. And so I got the ultrasound done a couple days later. She emailed me the results, and at the, title of the email, it said, everything looks great. And if your pain is still persisting in 3 to 6 months, call me back. And I am so glad that I opened the test results that were attached that day, because if I just had read that message and said, oh, okay, nothing's wrong, I don't have to look at my test results, then I would have not known what was, causing my pain. So I opened the test results and it said that I had a 3 centimeter complex right ovarian cyst and a bunch of other medical terminology that I in no way understood. So of course I see this and I'm immediately concerned that my doctor didn't tell me that this was on my test and what it was. And again, it was all this medical terminology that I didn't understand, so it was completely overwhelming. So I decided to email her back and say, hey, what's this mean? It says that I have a 3 centimeter complex right ovarian cyst. Can you explain what that is? And if I should be concerned about it. So I don't get an email back from my actual doctor. I get an email back from the nurse practitioner that works there, basically telling me that I'm overreacting, that if it was a concern, my doctor would have mentioned it. And like it said on the report, that if I'm still experiencing pain within 3 to 6 months, to call them back and they'll reevaluate. So that whole situation really pissed me off. I didn't like the way that I was treated. I didn't like how dismissive they were and passive. I didn't like the fact how I had to go and reach out to my own doctor instead of, all she had to say was, hey Sam, it's gonna say that you have a 3 centimeter ovarian cyst. This is what it means. It's not a big deal right now. As long as you feel better, it should go away. If it doesn't and you still have pain, just call me back and we can set up another appointment to see if it's, gone away or not. That's all she had to say, right? So at this point, my parents convinced me that I need to go see a different gynecologist and get a second opinion, because at this point, not only was I still experiencing all these symptoms and they were gradually getting worse and worse, and now this really severe ovarian pain that's obviously explained by this cyst, everything kind of just seemed like something was really going on that wasn't right, and I needed to go get a second opinion. This gynecologist was also a little reluctant to do another ultrasound, kind of told me the same thing, that cysts are normal and most of them go away on their own. So it's kind of like, you know, not really necessary to do another ultrasound, but because, you know, I'm still in this really severe pain, he's gonna go ahead and do another ultrasound, and so I did. Thankfully, they were able to do the ultrasound right then and there. They had a tech in office and then a radiologist as well in the building. So they were able to just do the ultrasound and get the results the same day. So I was sitting in the room waiting for results with my mom, and the gynecologist comes in, sits down, basically tells me that my cyst has tripled in size within this month, which leads them to believe that I have ovarian cancer. So my doctor then tells me that there's an oncologist just down the road that's one of the best in Southern California, and she can do an emergency surgery for me tomorrow morning to remove the cyst and anything else that they possibly need to remove if it is cancer, and that I need to go downstairs to take a bunch of labs, specifically a CA-125 and a bunch of other tumor marker tests, and I also need to sign a bunch of papers, and yeah, that I would be having an emergency surgery the next day. This was all a lot for me to take in at that time, and to be frank, I don't remember a lot of it because I think I kind of just zoned out and kind of repressed a lot of it because I wasn't really ready to handle that. And again, I was just freaked out that I had cancer and that I had to have emergency surgery. I mean, it's a very stressful situation to be in for sure. So the next day I have the surgery, and when I woke up, I was told that it wasn't cancer, but I did have endometriosis. They were thankfully able to remove the cyst, which was an endometrioma, without damaging my ovary, and she basically told me that endometriosis was basically just my uterine lining growing outside of my uterus, but it was a good prognosis because I only had it in my pelvic region. She only found a little bit, you know, around my ovary and my fallopian tubes, and that she removed everything, so I should be good to go for the rest of my life. So at this point, I was really happy. I was like, oh my gosh, okay, so it's not cancer, it's this other disease that I'm just now learning about, which doesn't seem so bad because she's saying that I'm now cured, so I'm good to go. Unfortunately, about a month after post-op, I started to experience these symptoms again of back pain, leg pain, migraines, headaches, pain with ovulation and periods, pain with intercourse, pain with urination, bowel movements, constipation. I also experienced chest pain on my right side and my right shoulder tip. And I only really experienced this like right before my period and like for the first few days of my period, and I didn't know what it was, and also along with that just shortness of breath. So all of these symptoms started to come back for me, and that's when I decided to start to do my own research on what this endometriosis was. So if you've ever tried to do research on endometriosis, you will notice that every website has different information, which is extremely frustrating. I'm back. So at this point, I was doing my own research, and like I mentioned, everything that I was finding was really conflicting. Some websites told me that it was the uterine lining and that surgery was a cure. Some told me the complete opposite, that it was tissue similar to it, that there's no cure, and I couldn't figure out how to decipher one from the other. So I decided to kind of do other research on social media to try to find people who had it and maybe who knew more information just based off of, you know, their own experiences. And that is when I came across the endometriosis community on Instagram, and I am forever thankful and grateful that I found that day, because they taught me everything I know about endometriosis. Basically, they taught me all the correct information. They had all the right resources. They were super supportive and welcoming and helpful, and I am so glad that I, you know, was able to reach out to people in the community in that way. In my opinion, it's a little sad that I had to learn about endometriosis and pretty much everything that I know through the community on Instagram. I couldn't rely on a doctor to give me factual information. I couldn't rely on Google to give me updated information that was correct. And quite frankly, I think that's disgusting, it's unacceptable, and it needs to change. So I kind of started putting the pieces of the puzzle together, and I quickly realized, well, if I'm having symptoms, I need to go see a specialist, because my doctor was, an oncologist, but that's not an endometriosis specialist, so I should go get it checked out. And so I took about a year trying out several different specialists, quote unquote. That's another problem that's unfortunately, really disgusting, is the fact that endometriosis specialists don't have to have like required education or qualifications to be able to call themselves a specialist. Any gynecologist can kind of just slap it on their name and call it a day. So you have to be really careful when you are choosing your specialist, because you can come across some that are not and really shouldn't be a specialist or call themselves one. So I went to a couple, I had really bad experiences with some. A couple of them had to like Google search endometriosis in front of me. They kept telling me, we're doing all these ultrasounds on you, but everything's coming back. And, endometriosis would show up on an ultrasound, which is not true. It's really rare that it does. And if it does, it's usually in the form of an endometrioma. So I kept like getting scans, and they kept saying, you're good. You had a surgery, you have nothing to worry about. Your doctor said she removed everything, so you should be good to go. So I was kind of, defeated. I felt really frustrated. And then I found my current specialist, thank God. And I'm going to explain more about him in the next clip. So thankfully, the last specialist that I went to told me all the right information. He didn't bullshit me and tell me that, there's a cure for it. Told me that there definitely isn't, that there's a lot of different treatment methods out there, including like surgery, birth control, medically induced menopause. There's also holistic ways that you can try, and, not everything is going to work the same for everyone. So it's kind of just like trial and error. And he reassured me and all of these other symptoms that I was having, basically telling me like, just by the fact that your doctor didn't check outside your pelvic region is a big red flag. And based on your symptoms of like your chest pain and all your other, digestion issues and abdomen pain and bowel problems and urination problems, you likely have like extra pelvic endo that we should address and possibly look into. So unfortunately, my last doctor who like diagnosed me with endometriosis and removed my cyst never took any pictures. So my surgeon didn't have any pictures to look at. And that is one big advice that I have for you guys, is if you are getting a surgery, definitely ask for pictures. You never know when you'll need them. They're also just really good to have for your doctor to kind of look back on, and other doctors that you go to look at. So definitely highly recommend asking for pictures to be taken. So because he didn't have these pictures to look at, and he kind of assured me like, just because you've been having ultrasounds done doesn't mean that you're cleared for endo. It doesn't always show up on scans. Scans are really unreliable, not only at just picking it up in general, but also radiologists, technicians, don't know how to recognize it most of the time. So it's kind of just like a waste of time in general to get scans, at least from his standpoint. So he kind of just told me like, the bottom line is, if you want me to look, we can do an exploratory surgery, and I can see where you're at, and then we can kind of go from there. So I did an exploratory surgery with him, and when I woke up, he told me, yeah, you have really severe stage 4 endometriosis. He even thinks that my last surgery was really unsuccessful, and that he doesn't think that my surgeon actually removed anything. Just by the looks of it, he really couldn't tell that she even touched anything or really removed any endometriosis that she saw in my pelvic region. But it was also on my bladder, my bowel, it was in my abdomen, it was all over my tubes, my ovaries, just my general pelvic region. It compromised my appendix, so he basically told me that the endometriosis damaged it so much that it needs to be removed. And then the kicker, the one that I suspected the most, was thoracic endometriosis, and I did indeed have endometriosis all over my diaphragm. He also said he took a look at my uterus, and just by the way it looks, he suspected that I have adenomyosis, and that he wanted to do like an ultrasound to check for that, because the only way to formally diagnose it is to remove your uterus and then biopsy tissue, and then confirm that it's adenomyosis. But of course I didn't want a hysterectomy. So that was kind of like the only way that we could do it, was just by him kind of like confirming it during surgery that he thinks that that's it, and then doing scans to see if it shows up. And I did do a scan later on, and it came back with suspicion of adenomyosis. So about a couple months later, I scheduled a third surgery to actually remove all of the endometriosis as well as my appendix at the same time. He had a separate doctor come in and assist him for the surgery, specifically for the appendectomy. So we went ahead and did the surgery. He removed everything and removed my appendix, and that is kind of the whole story of how I reached my final diagnosis of stage 4 endometriosis and adenomyosis. Now, for the part that a lot of you have been waiting for, is to hear about my experience with surgery, kind of like what I've been through, what I recommend for pre and post-op care, what kind of questions you should be asking your doctor, and then I know a few of you asked me questions over on my Instagram that I'm going to answer as well. So first, I just want to talk about like surgery basics. If you do get a surgery for endometriosis, likely you will have a laparoscopy procedure. Usually the incisions will be really small and you'll likely have around 4 or 5 of them. Personally, my doctor used a Da Vinci robot, which I believe is pretty common to use in gynecology and endometriosis surgeries in general. And there's 2 different types of removal strategies that doctors can use, and it's either excision surgery or ablation surgery. So the best way I like to describe the difference between excision surgery and ablation surgery is if you imagine a plant and it's in the ground with roots, and a doctor performs excision surgery, it will physically cut out the plant and remove everything along with the roots. But if you imagine a doctor performing ablation surgery on that plant, it's just going to burn off the surface and not address the roots. I have heard that some doctors use both, specifically in certain areas where endometriosis can be, that you can physically not perform only excision surgery. Some doctors will kind of do like a combo. Overall, there's pros and cons to both excision surgery and ablation surgery, and a lot of people will agree that excision surgery is best if that's feasible and accessible to you. Excision surgery is a more invasive procedure, so the recovery time is a little bit more difficult and long for most people, but it is the best form of surgery in that it gives patients longer periods of pain relief from symptoms, and it also gives the surgeon the ability to have high precision, especially when treating severe endometriosis, and it also gives them the ability to remove most of the disease present. With ablation surgery, more surgeons are trained in ablation, so you'll probably be more likely to find a surgeon that can perform ablation surgery. It's also less expensive, less invasive, so there's a shorter recovery time. But there's a lot more risk for just damage in general from the burning process. And when you burn the tissue, you can't run it through pathology. And unfortunately, you're less likely to experience pain relief for especially long periods of time after your operation. So a lot of people will say that you shouldn't get a surgery unless it's excision surgery. And while I do have that opinion mostly, I do know how difficult it is to find surgeons, to find specialists, to afford surgeries, and really honestly, whatever works for people works for people. If you got ablation surgery and you're doing really great, that's amazing. If you got excision surgery and you're not, getting that same pain relief that, is promised with it, that's totally possible too. It doesn't work the same for everybody. So really, when it comes to surgery, I have no judgment on whether or not you should get ablation versus excision. It's really what's accessible to you, what you think will work for you best, and what you and your doctor have come up with together. So in terms of my experience with surgery, my first surgery to remove my cyst and the actual time that I got diagnosed with endometriosis was not too difficult to recover from. I think it took me about 2 weeks to start feeling back to normal. And that's when I was able to kind of return back to work and school and all that stuff. My incisions healed fine. I didn't have any issues with infections or anything post-op during that time. During my second surgery, I had a really quick recovery time, and that's because obviously nothing got worked on. I just had incisions, and basically they just looked. They didn't touch anything. So that recovery took, less than a week to start feeling back to normal. Obviously, just uncomfortable with incisions and everything, but overall didn't have too much pain or soreness from the surgery itself. And my third surgery is where it was absolute hell for me personally. My third surgery is the one where they removed all of the present endometriosis that they could see, as well as my appendix. And man, was my third surgery hell. It definitely was. It was really hard. Not only was it difficult just in general because they were working on so many different parts of my body, it was a really long procedure. They thought it was only going to be an hour and a half, but it ended up being close to 4 hours long. And I also unfortunately had complications from the surgery. About 2 days after my operation, I had to be rushed to the hospital with a very high fever and tachycardia, and they basically told me that I had fluid in my pelvis that was infected from the operation. So I had to stay in the hospital for like 4 days, basically on like 3 or 4 different antibiotics, couldn't eat, couldn't keep anything down, severely just messed up from the whole process. I mean, like, coming out of a surgery for me has always been hard, and I don't know if anybody else experiences this, but my mental health is shit after a surgery, and I don't know if it's the anesthesia and the drugs, or if it's just like the experience itself being invasive and like working on all those different parts of your body. But I felt like ass, to be honest. And I have never felt so sick in my life with that infection and just recovering from a surgery that invasive and difficult. So with the complication and just like the degree of how difficult that surgery was in general, it took me about, I'd say, a couple months probably until I started to feel like I was turning a corner. But it really took me like 5 to 6 months to start feeling like pretty normal again, and like I could actually do activities and like, you know, not feel fatigued or out of it as easily. And I was told after my appendectomy not to lift or really do any severe working out for like 6 months after my surgery anyway. So it was around that time when I started to feel like I could actually work out again and just like live normally. When it comes to recovery time, it really is so dependent on the person. Often your doctor will tell you, oh, you know, you'll be good to go in 3 to 5 days, you can return to work, and you won't have like, you know, too much pain because it's you know, the procedure itself with the small incisions is not super invasive. A lot of people recover really quickly. And to that, I say that is not true. It really depends on the person. Rarely do I ever hear anybody in the community talk about how they recovered from a endometriosis surgery within 3 to 5 days. I'm sorry, that's just like kind of ridiculous. But honestly, I'm really jealous if that's you. And I don't know how common that is or if a lot of people do and I'm just crazy, but I really rarely hear that. Often it's way longer than that, months. I've even heard some people say it took a year to fully recover from the operation or more. So it really depends on you, and I highly recommend to you know, think about that because a lot of people will get the surgery thinking that they can return to school and work pretty quickly after. But I really just don't think that, you know, that's the case for so many of us. Personally, I had to drop from a quarter in my school because I needed time to recover, and I was in no way mentally or physically prepared to handle a full class load. I also will say that I personally needed somebody there with me to help me in recovery, whether it be, you know, helping me change, helping me get to the restroom, helping me walk around, helping me with food and stuff like that. Especially for the first few weeks, I did need somebody to kind of help me out. So I highly recommend, if it's possible, to have a family member or a friend come over to your house to help you in your recovery. One of the number one things that I noticed after my surgery was that I had extreme like trap and shoulder pain and chest pain, which is from the gas that they fill you with during the laparoscopic procedure. And a lot of us do experience the gas pains. And for me personally, they were really, really bad. So what helped me with that was heating pads, and I would place them like on my traps and on my chest. And then I also drank a lot of peppermint tea, which seemed to help. I kind of want to backtrack just a little bit because I wanted to address some questions that you should be asking your surgeon, both for just the overall procedure, their experience, and then pre-op and post-op care. An account on Instagram called Thrive with Endo put together a list of questions that are really important to ask your doctors in a lot of different situations. And I still think the list to this day is really, really valuable, and I will include it in the description, but I'm going to talk about some of them today. So in general, for surgeon experience, you want to make sure that your surgeon is obviously experienced enough to give you the best results from your endometriosis surgery. So you want to ask some questions like, what's your experience? Have you done any fellowships? How often do you do excision surgeries? How many endo patients do you have? You should also ask them if they are familiar with extrapelvic endo and how they typically handle endo in different organs and bodily systems, and just generally what they know about all the different forms of endometriosis that can possibly occur. In terms of a surgery, you want to ask them what types of tools that they use, what the procedure in general is like from start to finish. For pre-op stuff, you basically just want to ask them how they recommend that you prepare your body for this procedure. You want to ask them if there's any kind of supplements you should be taking before, or things that you shouldn't be consuming before, in regards to like medications or certain supplements and foods. You may also want to ask if there's going to be any kind of procedures before, such as imaging, blood work. You should also talk about post-op infections and how preemptively you can kind of combat those, whether it be with antibiotics or, bowel prep, different kinds of soaps that you can use to wash your body with before the operation. And in general, you want to ask for like a list. A lot of people call it a countdown list, where they basically tell you you need to stop taking these medications at this day, at this time. This is what you should do 24 hours before, or just kind of like a checklist of what to remember to do before your surgery. For post-op, you want to ask them what types of protocols they usually recommend. For pain management, you want to ask certain types of complications that can occur, and what to look out for with those. So like a high fever, or maybe the incisions being a certain color and indicating that there may be an infection. You want to make sure to ask for photos of the procedure and a report of what went down, like their notes, surgery notes. You also want to make sure that they're going to be doing a pathology report on the tissue. You can also ask what should be expected in the post-op appointment, which is usually around 2 weeks after your operation. They see you. What kind of stuff, what are you guys going to go over with me? Is it going to be the pathology reports? Are we going to talk about other forms of treatment that I can do to help manage pain, or other forms of pain management like pelvic floor physio and other kinds of medications I can possibly take. And most doctors will include this on your pre-op papers, but you want to make sure that you can reach either the nurse or the doctor at all times of the day. So just contact information to reach them. So I asked you guys on my Instagram to submit some questions that you have in regards to surgery, and I'm going to answer some of them right now. So somebody asked, how long after surgery did I notice relief from my symptoms or pain? And I will say at first it was really difficult to tell, the difference between my surgery pain and like just my endometriosis, and I couldn't tell, like, was I actually getting relief from the surgery, or was it just my surgery that was causing me to have pain and I'm still just recovering from it. I really hope this is the last one that I have to film, but I can't make any promises. So I was having a really hard time deciphering between the pain from my surgery and if it was my endo. I really couldn't tell. I even went to my specialist like 2 months after the procedure complaining of pelvic pain and bladder pain, and he kind of just sat me down and he's like, listen, you had a really invasive procedure. You need to give it time because, especially because of your complications and everything, it's likely just you and your body needing time to recover from the operation. But what really gave me hope was that my periods were a lot better after my surgery. I think the first one that I had post-op was a little weird, but other than that, they were a lot lighter. They were a lot less painful. My ovulation pain was so much better. Digestion issues were so much better. Pain with sex was so much better. I did need to continue to, do some pain management and like physical therapy after surgery to kind of help with the recovery process. And then that pelvic soreness and the bladder issues that I was still experiencing after my operation that I was kind of concerned about, they did get better. I really think the bladder pain might have been my IC, which I didn't know about, and I go on to talk about like how I came to the conclusion that I had IC, and then once I started to address it as IC, it got a lot better. So, with the help of physical therapy and kind of just letting my body recover and my symptoms just overall getting a lot better, I felt a lot of relief from my operation. And my relief that I got from my surgery was life-changing, completely different than what I was before. I'm completely able to function. I have, my life back, which is amazing. And that relief has lasted now a year. But I will say that within the last couple months, I have been starting to experience some bad days, which were, rare, if ever, within this last year. And I've had a couple flares, and again, they're not as bad as they used to be. I mean, when I had flares before my operation and like the removal of everything, I was out for weeks. I was sick all the time. I had chronic pain every single day. Every day when I woke up, I was in pain. Every day when I went to sleep, I was in pain. Someone also asked me what I did post-op to manage pain and healing, and thankfully my doctor prescribed thymosin beta-4 injections to do to basically help my body heal. I also used a lot of heat. I had TENS machines to help with pain as well. I also used cannabis, because I do use cannabis for managing my endometriosis in general, and just pain control, because for me, I am highly sensitive to opioids, and even anesthesia makes me really sick. I just get really nauseous and I often throw up from them. So I have opted for cannabis, which actually helps combat my nausea at the same time as make me feel better. I would say about 3 to 4 months after my operation, I started to see a physical therapist, specifically a pelvic floor physical therapist. I had seen one previously, just for in general my symptoms, and I highly recommend it if it's possible for you to try. If you have any kind of like pelvic pain, whether it be with sex or endometriosis, PCOS, pelvic floor physical therapy is really diverse and has a lot of benefits for a lot of different conditions. And as I mentioned previously, I also really like peppermint tea. It really helped with just my overall cramps, nausea, and the gas pain that I was experiencing in my chest and my traps. So those are all the things that I like to talk about when I am discussing surgery. Just again, keep in mind that it's not the same for everybody. What I went through might be completely different from you, or just others in general. It's really, really dependent on your situation. And those are just some things that you can think about. So now I'm going to talk about some post-op things that I've been doing to manage my endometriosis and just my chronic illnesses in general. Quickly, I do want to talk about IC though, because I have gotten questions about that, and I don't really talk about it too much. So IC, or interstitial cystitis, is basically painful bladder syndrome. It is really common to have with endometriosis and other conditions. The symptoms for IC and adenomyosis can be really similar to endometriosis. So for me personally, I have a hard time kind of figuring out what's causing what, because all of them have a lot of the same symptoms. Like IC has symptoms of pelvic pain, frequency to urinate, pain with urination, bladder pain, bloating, pain with sex, which are really similar to the symptoms with adenomyosis and endometriosis. Basically, the way to get diagnosed is to have your doctor rule out everything possible that could be causing your bladder issues before basically telling you that you have IC. There's no definitive test out there that you can do that will say, oh yes, you have IC. So the way that I got diagnosed is I basically tracked my symptoms over a long period of time, and I brought them to my specialist and just said, hey, I'm still dealing with these symptoms even after my surgery with endometriosis. I still feel like I have a chronic UTI, and I keep getting these UTI tests done and nothing keeps coming back. It always says that I'm clear, I don't have any kind of infection. And I'm kind of just wondering like what it could possibly be. And he basically told me, well, there's a really common condition called IC that is really common to have with endometriosis. And based off of your symptoms, it sounds a lot like IC. We can go further if you want to do a procedure where I basically look inside your urethra and bladder. I'll put the name of it right here because I'm blanking right now. But personally, after all of the surgeries that I've had, I just didn't really want to go down that road at this time. In the future, if I see that my bladder symptoms are becoming debilitating or interfering with my life, I might go down that road. But as of now, I've been just diagnosed with, suspected IC, and I am kind of just managing it and treating it as I see. So in terms of treatment that I have been doing for my endometriosis, a lot of it has been very holistic. As I mentioned before, prescription medications don't usually sit well with me, and the last time that I was on BC, I had a really horrible experience with it, and quite frankly, I just didn't want to go on it again. So as of now, I am not on any kind of birth control. The only prescription medication that I am on is a natural bioidentical progesterone supplement. After my diagnosis, I sought out a naturopath just because my mom uses one and I have a lot of autoimmune illnesses in my family history, so a lot of us have just gone the natural route and have found it to be really helpful, and I wanted to try it. So I do see a naturopath alongside with my specialist. I got my hormones checked after my operation to kind of see where I was at, and quickly realized that my hormone ratio was very off. I was significantly estrogen dominant, and I had like no progesterone. So that's when my doctor prescribed the natural bioidentical progesterone made at a compound pharmacy near me. And then to help with the estrogen dominance, I was also prescribed to take DIM, which is basically another supplement that helps with detoxing estrogen, as well as calcium D-glucarate. I had, again, blood tests done to make sure that these would work for me, and just based off of what she found, she prescribed these for me, quote unquote prescribed. I buy these like from a supplement store. They're not like prescription drugs, but she told me that I should take these and told me the correct dosages and when I should take them and how many times a week I should take them. And I still frequently get blood tests to make sure that my hormone ratios aren't off. Along with all of that, I also was recommended to take a bunch of other supplements to help with inflammation in general. So turmeric, omega-3, magnesium, trying to think of any more. I was very low on other supplements as well, just general ones. And I also found out that I had a gene mutation. I believe it's like called the motherfucker gene mutation, where basically I don't methylate very well on my own. So I was prescribed like B vitamins, folate. I had really low vitamin D levels, so I take vitamin D. I also take serapatase, and I don't know if I'm saying that right, but I'm gonna put the spelling for it here. And that's supposed to help with scar tissue, specifically for endometriosis, as well as glutathione, which is supposed to help with scar tissue and just liver functioning and a lot of other bodily functions. And then I take grass-fed beef liver for my iron deficiency that I have, and I take vitamin C alongside that to help me absorb it. Again, I got all of this worked out with my naturopath. I got, a lot of blood work done to make sure that I wasn't taking too much of something, or that if I added a supplement into, my routine, it wouldn't be harmful for me. It's always good to check with your doctor to make sure that you're taking the correct supplements in the correct dosing, because it can be really harmful in some cases to take too much of something. So in terms of diet, I don't do any restrictive dieting besides gluten, because I am intolerant to it, so I don't eat gluten. When it comes to other things that I try to avoid dairy and soy, mostly because those really do bother me. I also try to stay away from inflammatory foods like processed foods, fried foods, gluten, red meat, sugar, caffeine, alcohol, dairy, if I didn't already say that. But all of these are considered inflammatory foods, and there's probably more that I'm not listing here, so I highly recommend to look it up and see which ones can possibly be inflammatory. But I have found that avoiding those and also adding in anti-inflammatory foods into my diet has been really helpful in just managing my overall pain and symptoms. I also have found that bad oils tend to make my symptoms worse, probably because they do cause inflammation. So I try to stay away from like canola oil and palm oil. And I mainly just stick to like coconut oil, olive oil, and avocado oil. And I also try to eat organic whenever possible, and I try to stay away from foods that are high in glyphosate. But again, I just want to repeat myself, none of this is restrictive. I have found that restrictive dieting is really harmful for my mental health. So I do occasionally, go against these said rules that I have. So I will go out and drink with my friends. I will eat fast food. I just have found that as long as I don't do it frequently, I don't seem to have, symptoms. But sometimes, after a night out with my friends, I will come home and the next day I'm in pain, and it just is what it is. Other forms of treatment that I've been doing is pelvic floor physio. I mentioned it before. It's been a lifesaver for me, specifically with my pain with sex. If you've never been to pelvic PT before, basically you have a physical therapist that works with you. A lot of the times they will do internal work specifically for endometriosis patients. But of course, if you're not comfortable with that, you can always communicate with them that you would not prefer to do that, and you definitely don't have to. They also teach you a lot of stretches and breathing techniques, and specifically for me, because I have a high tone pelvic floor dysfunction due to my endometriosis, I learn a lot of things to help relax my pelvic floor and my muscles. So right now I currently go to PT around 1 time a week. Sometimes I'll skip, just depending how I'm feeling. Previously I was doing it twice a week, but now I feel better and good enough to kind of not do that, and I will take breaks. And now I'm back at it because I feel like it was really helping me just to have that internal work being done. But I will say it's not cheap. At least where I go, it's out of network, and I've heard that that's the case for most places, is that they're not covered by insurance. So if it's accessible to you, I highly recommend it, but I understand that, it's definitely not feasible for so many of us because it's not cheap. As I mentioned before, I love heat. I love TENS machines. If you don't know what a TENS machine is, it's basically a device that sends electric pulses to your nerves to basically cut off pain receptors being sent to your brain, and it also helps your body to produce natural pain-killing chemicals like endorphins. As I mentioned before, I also use cannabis products and CBD products, so it can range from actually using THC and smoking it or eating it, or I use like CBD oils, creams, lotions, bath bombs, and salts. And then in terms of managing my IC, I try to avoid certain foods that I know trigger me. So a lot of teas don't sit well with my bladder, or spicy foods, acidic foods. And I also have found that aloe vera, drinking it with pulp, has helped my bladder a lot as well. And again, pelvic PT can be really great for IC as well. Okay friends, that's all I have for you today. I hope you enjoyed, and I hope the information was, not too much, but also enough to help answer some of your questions. If you did like this video, please give it a thumbs up, comment, and subscribe. The more interactions I get with this video, the more it will be pushed out into the algorithm and hopefully reach more people who are looking for this type of content. I hope you all have a great rest of your week, and until next time, bye guys.